Equipments used in this video are disposable gloves, sterile gloves, woven gauze, antiseptic swabs, biohazard waste bag, and an adhesive tape. Hello there, I'm Barbara, and I'm your medical assistant today, and I'll be changing your dressing, okay? Could you please confirm your name and your date of birth, please?
Emerson Aguilar, January 4th, 99.
Okay, I'll go ahead and wash my hands right now. Thank you. After properly washing my hands, I would now place my clean disposable gloves. Afterwards, I would check if there is no tears. If not, I would go ahead and place my biohazard waste bag nearby for my convenience when discarding contaminated supply in order to avoid cross-contamination around the examination room. Afterwards, I would now remove the dressing by folding in the four corners of the dressing. Note, I should always avoid touching the inside of the dressing because it's contaminated. After properly removing dressing, I would inspect the wound for amount of healing, presence of inflammation, and presence of drainage. In case there's a presence of drainage, I would note if the amount of drainage is scant, moderate, or profuse. And if it's serious, sanguineous, if wound has a presence of drainage, I would go ahead and take a swab of discharge and go ahead and take it to the lab and inform physician right away. In this case, then, since there is no sign of infection, I will go ahead and remove my disposable gloves and go ahead with the next step, which before applying my sterile gloves, I would now, after sanitizing my hands, I would now open the woven gauze by dropping it in the sterile field. Afterwards, I would now apply my sterile gloves by properly opening my package. Note, I should not touch the inside of the package. That's why there is a proper way of opening, like this. Afterwards, I would use my opposite hands in order to help me get my left hand inside of the glove by having a grip on the inside of the glove because the inside will be touching your bare hands. Note, I should not touch the outside of the glove because it's sterile. If I do so, I would have to start all over again sanitize my hand, and get a new pair of sterile gloves. After properly applying my left glove, I will go ahead and apply my right side glove by having my 2 fingers in the cuff of the glove and properly inserting my right hand in and adjusting it. Afterwards, I should check if there is any tears. Since in this case there is not, I can go ahead and proceed with the procedure. The next step consists with now cleaning the wound with antiseptic swabs. I would start from the middle, up, down, then discard, get a new one. Then I would apply on the right side, up, down, discard, and get a new one from up, down, then discard. Afterwards, I would go ahead and apply my gauze at a certain distance. Be careful not to apply right into the wound by dragging, because it would increase the chances of infection, or it would either cause a trauma to the infection, to the wound. Afterwards, I would go ahead and remove my sterile gloves because it's now contaminated. By properly removing is trying not to, by having a grip on the glove, removing it and forming a bowl, then go ahead and place my 2 fingers inside of the glove and go ahead and take off my right glove. And afterwards, I would go ahead and discard in my biohazard waste bag. Afterwards, I would go ahead and tape it down, the gauze, with adhesive tape. After procedure is done, I would go ahead and explain the patient the wound care instructions. I would please ask them to keep the wound clean and dry, and please report to the office in case of excessive swelling, pain, or discharge. After that, I'll ask the patient if there is any questions. If not, I will ask them to sign the instruction sheets with their date and signature. Afterwards, I would also sign and date my signature. I would go ahead and make a copy of the instruction sheet. I would then file the original sheet into the medical records of the patient and go ahead and provide the patients with the copy of it. After all, the patient will be discharged. After my patient leave, I would go ahead and clean up by cleaning up my procedure area and properly discarding my biohazard bag and the biohazard container. Afterwards, I would go ahead, sanitize my hand, and chart the progress notes of discharge of a patient.